Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, thanks for joining me on this special episode of the Gastro Girl podcast. This episode is brought to you by Ardelyx, and we're pondering a really interesting question this time. And we've talked to several patients to get their perspective on what better means to them. Now, hear me out. We all know what it's like to go to the doctor, and the doctor asks us how we feel, and they ask if we're feeling better. But what does better mean, right? What is the doctor or the provider's better? What do they think better is compared to what we, the patient, feel is better? Like, how are we setting the bar for what better means to us? Well, we just thought the best way to get to the root of this is to talk to patients that are living with IBS or IBS-C and see what their perspective is on what better means to them. Take a listen. Good morning, Karen. Nice to see you again.
Good morning. Great to be with you.
Well, we're going to ask you a couple questions, but for those of us who may not have seen your earlier episode, can you just give us a brief capsule of, your patient journey?
It's hard to take 10 years in a brief capsule, but that's really what it was, where post-infection, I developed a lot of IBS symptoms and went to countless doctors, spent thousands of dollars with really no answers until I did reach a place where a doctor was able to diagnose me properly. But in that 10 years, quality of life was terrible. Pain was present 24/7, 365. And I was miserable, very miserable.
And you have IBS-C?
Correct.
Yeah, and that can be very uncomfortable.
Yes.
So as we talk about, what was interesting is the question that was posed, what does better mean to you? And when we have, the providers and patients, they may be thinking in their head what better is. And the patient, we as patients may think, what we know in our head is feeling better. So I'd like to ask you, when a doctor asks you, are you feeling better or how are you feeling? Like, what does that barometer for you mean? Like, what does better mean to you as a patient?
Better ultimately on this side of it is I want a return to the quality of life that I once had, but that wasn't the case. It was a process, of course, and better is instead of feeling pain 365 days, maybe it's down to 340. And then meaning that the symptoms are on a continuous decline versus up, down, up, down. So ultimately return to the previous life. But I would say there were many times where I said, well, I'm feeling better than I was 2 months ago or 3 months ago.
So there's like a range. So for instance, if your provider put you on a specific treatment plan or a medication and you came back in 30 days and he asked you, how are you feeling? Like what does that mean to you?
The first thing that comes to my mind is just how vulnerable you feel, because here's an educated doctor asking you questions and you want to respond in a way that's real. It's a little intimidating sometimes, but the important thing is to have that relationship with your doctor and just be honest. And so there were times where I was on different medications and I would say, this one, I really don't feel any better. And we would try another medication or we would try another path. It's a vulnerable place, but just be open and be honest.
So like for going to work, if you work outside your house or even if you're working at home, better could mean, just better mean you were comfortable at your desk for 4 out of the 5 days, right?
Yes. And I got a heavy sigh when you said going to work, because that was hard. You're managing pain, you're managing the symptoms, all the while you're trying to push through and do the job that you're being paid for. So whether you're doing things at home for family or you're going to a workplace, better means that you're not having to manage the symptoms and the pain as often or as frequently while you're trying to work alongside that.
So we're kind of in this conundrum, we're going to our office visits with a doctor and they ask us how we're feeling. But, what are they basing it on? Like, what is their idea of you feeling better versus what your idea of you feeling better? What is where do we kind of level the playing field?
Well, I think it's a challenge because ultimately they're looking for data. They're looking for numbers, or they're wanting to know on a scale of 1 to 10, how's your pain? Or, out of the 7 days of the week, how many days? And all the while, better means I just really want to feel better, but they are looking for signs of improvement. Ultimately, I think anyone who's in the medical field wants to help. They want to fix. And so it's really important to communicate and make sure that you have the right dialogue with your doctor.
Yeah, and we've talked to many patients, even in our conversation earlier in the earlier podcast, where you were on the couch and you just couldn't move. And then, for you, feeling better was not being on the couch for most of the day and being able to interact with your family. I mean, but how do you measure that in data, right?
Exactly. How do you measure that? How do you measure quality of life? How do you measure the feeling of sense of well-being? You can't put numbers to that. And while on the one hand, you might say, well, my pain level's at a 7 versus a 10, I'm still not myself. And be honest again with the doctor and be your own advocate and stick with it and trust your doctor in that regard.
And just a final thing, Karen,
Sure.
if you don't mind, if you could say, a piece of advice for providers from a patient perspective, what would you tell them?
Listen, be compassionate, don't dismiss the symptoms that an individual is feeling, and recognize you might not have all the answers, and that's okay. And to just continue again to be there for your patient. And if it reaches a point where you don't have answers, refer them to somebody else. That was a breaking point for me, and I'm so grateful for the doctor that said, I can't help you, but I know someone that can.
Oh, thank you so much, Karen. It's so great to see you and appreciate your insight as always.
Great to see you guys. Thanks so much.
Now, a common thread that seems to have come up throughout all of our conversations in this episode is quality of life. So patients are associating better with their quality of life, and quality of life is different for each patient. Now, we'll hear from Erica, who is not only living with IBS, but she also has a chronic digestive health condition called celiac disease. So her quality of life may mean a little something different and also take on a whole different perspective. So let's hear what Erica has to say. So we talked a little bit about this before, and it's kind of an interesting question. When we go to the doctors and they ask us, how are you feeling? Are you feeling any better? What does that mean? Like, what is the measurement of that? And, the doctor may have something in his mind what better is, but you as a patient, what does better mean to you?
Yeah, I think that's a really difficult question because I have conditions that are not really meant to be cured or like in remission, really. Like they're pretty much ongoing conditions. So, celiac obviously is a long term autoimmune disease. And I know that I can help regulate my symptoms, by following a strict gluten free diet and making sure my numbers are down. So, that really is better for me. But that's not necessarily the one that drives me up the wall and drives me to go see a GI all the time, which is IBS. And for that, again, a longitudinal issue that I'll probably be dealing with for a while. I have ebbs and flows. So I can say, yes, I'm better right now. And for me, the better means a quality of life index. So, I mean, I'm not really punching in the numbers like, let's say I got a 70% on dining out with friends and a 30% on not wearing a diaper when I travel. I think it's just looking at the big picture and seeing like on a daily basis, am I thinking about my condition more than I think about my actual life, like the life that I am living. And on some days, I'm thinking about my IBS a lot more than I'm thinking about my daily life because my stomach hurts. I'm going through a flare right now because I'm so stressed. I had a lot of travel issues with my MacBook. So my body's like, oh, this is the time to panic, right? We should send your body in overdrive and like send mast cells, and everything's very excitable in my body, which means a lot of IBS. Now, today, I'm thinking a lot more about my IBS than I traditionally would on a regular basis. But overall, it's been pretty good. Now, when it comes to those days that are outnumbering the days where I think about my condition more than I think about my regular life or like my goals and my dreams, that's when I realize it's time to head back to the GI and say, maybe this isn't good. Maybe my quality of life isn't great. And is there something that we can do to make it better? Is there medications? Should I be checked for additional autoimmune diseases? Should I be modifying my diet with a dietitian? Like, what should I be doing to help my quality of life? Because ultimately, that's kind of how I gauge if I'm better or not.
That's a great insight, Erica. I really appreciate that. So what would you say to providers who ask you that question? Like, what are your tips for them in terms of helping to level the playing field so you both are talking about the same thing, if you will?
Yeah, such a great question. I think that GIs really need to not just ask, like, how are you feeling? It's such an open ended question. And I think that a lot of people are just so conditioned, especially here in America, to say, good, and you? And there's no real actual feedback between them. So I think it all goes back to GIs asking those probing questions. Like, so how, like on a regular week, how is your gut feeling? Like, how many bathroom trips are you making? Have you had bowel urgency lately? Have you had diarrhea? Like, do you have cramps? And, asking the questions about the actual symptoms instead of like, how are you overall? I think that doesn't really get down to the point. We're just so conditioned to say, yeah, I'm good, especially women. I think our pain and our issues have been overlooked for so long. We're just so used to going along with it and saying, like, I'm fine, this is fine, when in reality, the world is on fire and our bowels are just like having a party in and of itself. So I think we should really be asked kind of probing questions to get down to the root of symptomology versus just, hey, how are you? And it's like, I'm great. And they're like, then why are you here? I think if that's the question, that's kind of the response you're going to get. So asking probing questions and really asking, in the last 7 days, have you blah, blah, blah? Or when was the last time you skipped a party because your body felt so bad? Or when was the last time you felt completely comfortable flying on a plane? I think that's a big one.
Oh,
There was
that's a great one.
a big story about someone who unfortunately had a
Oh,
diarrhea
I
incident,
read about that, and they
and
made
so
fun of
sad.
it.
But there's so many people that messaged me that said that they've worn adult diapers on a plane just in case. And I think that that's a big red flag to me, that you don't feel confident in your own bowels to be on a plane. Believe me, because I've been there and I have absolutely done that. And I get it. I get it so much. But people are modifying their diets, modifying their lifestyle choices to do things that are kind of normal, quote unquote, to other people that don't have it. And that's when you start to realize, like, oh, maybe this means that I'm not okay. And maybe I should seek future treatment. And, I give shout outs to all the GI patients that have to navigate these choices on a daily basis. And thankfully, people I know have good GIs that are working with them to try to really help them out. But man, we as patients live with such like a really difficult burden for our, quote unquote throwaway issue of IBS, that it's like, this is such a bummer, man, that we have to deal with it. And so to ask these questions to really address, are we okay? It is really important for the GI. And it's really embarrassing to talk about these things to other people. Even I, who am so forthright on talking about my bowel habits, when I talk about it to a GI, especially a new one, I get very anxious, like I'm talking to a stranger and they're going to judge me, but that's their job. They
Mhm.
have to hear about these stories day in and day out. You shouldn't be embarrassed, and being absolutely 100% honest and very detailed is what they need in order to help you feel better.
Absolutely. And detail is so important. And we've had numerous experts, GIs and others, who say the same thing. Don't feel embarrassed. The more information they have, the better they can help guide you to the most effective treatment option, or even if you don't have a diagnosis yet, to the right diagnosis. So thank you.
Absolutely.
As always, a pleasure to see you. Well, we really got some great insight from Erica. Not only did she share what her patient experience is with with talking with her healthcare provider, she also offered some really important tips on how we as patients can be empowered to understand what better means to us and be able to communicate that to our healthcare providers. And if we're not getting the questions asked that will allow us to really explain what we're dealing with and what our symptoms are feeling like and how that's impacting our quality of life, she really gives great advice here. Now, I'm really excited that we've asked one of our longtime friends here of the Gastro Girl podcast, a longtime patient advocate who's really been a patient. He has IBS, IBS-C, as well as IBD. He really has a really interesting perspective, and he's had a lot of experience as a patient for most of his adult life, really communicating with a variety of healthcare providers. And he's seen how it's evolved over time. The relationship between the patient and provider has evolved over time. So we really thought we would bring his perspective here today, and I'm really excited. So listen in. Well, we're here with Jeffrey Roberts, an IBS patient advocate, and he's also founder of the IBS Patient Support Group. I've known Jeffrey for years. We've done lots of fun things together, including a few podcasts here and there. But it's always great to speak to you. You have such great insight. So today I'd like to just kind of see your thoughts on, when you visit a doctor and they ask you how you're feeling, in their mind, if they ask you if you're feeling better, what are they thinking? And then what are you thinking? What is better for you as a patient? When a doctor asks you that, what is your barometer for feeling better?
Well, first of all, thank you for having me, Jackie. Yes, we have known each other a very, very long time, and I'm really happy to participate in this discussion. So for me, when I get access to my doctor, who knows me very well, we tend to focus on, am I able to live my life? Am I able to participate in activities with my family? Am I able to participate in family trips? That for me provides a better quality of life. But what does that mean in terms of IBS? Well, especially with constipation, it means that it's very unpredictable. And so I have to sometimes ask the doctor what he means, to understand what is he looking for. Is he looking for a medical perspective, or is he looking for, hey, I've got constipation for 4 days, and then it may be unpredictable that today's the day where everything is going to empty out and then I'm going to start my cycle all over again. So, we have that discussion. How do I even those out? How do I make the days so they're not like that? How do I live a more normal and better quality of life? And that's the challenge, because he's thinking medically, in the first minute or two, he's trying to think, okay, what's the plan that I'm going to put together for this patient? And from my perspective, I'm trying to talk about quality of life. And quality of life might mean diet. It may mean, cognitive behavioral therapy, in order to maybe manage the fear that I have or the stress that I have, that if I'm doing an activity, I'm suddenly going to be stricken with having to find a bathroom, or I'm in such intense pain. How am I actually going to get through the event that I'm at? So it's difficult to describe it when I'm with a physician, and I actually go in there with my own concept of what I want to talk about. And it is really to get back to a normal quality of life.
Well, you made this is all great stuff, and it's really great points, but I love when you said, when you go to your appointment, you ask the doctor what they're looking for. So you have an understanding of how to answer the question, right? If he's looking for some kind of medical barometer, or if you were on a medication and you no longer suffer from X symptom because you took that drug, that could be what he's looking for, right? But if you're thinking about what you just said, just managing day to day and living your life, being able to travel, seeing your grandson that you just told me about, being able to feel good to go do that. I think that's a great point that you just made, asking the doctor what they're thinking about.
And it's true. And I think a lot of patients, wait months and months in order to see their physician, and then they only get maybe 10 minutes with them. And I think you have to go in there with an idea that I need to manage this conversation as well. And I think I'm really good at that, because I've been, dealing with IBS for so many years. And also I have insight because of the work that I do in speaking to patients about what they're going through. I understand what might work for me and might not work for me. So I go in there with some suggestions, as in, might this medication be appropriate for me, given the situation, or am I going to run into trouble with it? Or often I say, if I run into trouble when I'm on a trip, what can I use as kind of my emergency stash of things that I can use? That happens also. I mean, I tend to walk around, especially when I'm traveling, with a bag of different medications that I can use or different things that I can use. I mean, my go-to in terms of severe constipation is to use Miralax, and I really hate to have to go that route, but that seems to work for me to clear myself out, and then I get to start all over again. So I don't necessarily have to carry around with me because it's accessible everywhere. But those are the conversations that I have with my physician to let him know, these are the things that I'm doing. What am I doing wrong, or what am I doing right, or how can I change this to have it smoother? So those are the conversations I have, more so than them suggesting something new. However, so if I'm seeing a physician because I'm being scoped, and I'm regularly scoped every so often, that's when they ask me, are you aware of this? Are you aware of that? And so they're attempting to introduce some new treatments for me. And I'm really interested in that because it's very difficult for all patients to really know what's available and what might work for them. You don't want to start both diagnosing yourself and treating yourself. You really need to rely on somebody else, and you really need that good relationship to do that. And I think I have a good relationship with my physician.
No, but that's fantastic. So when you say, you're feeling better, like, just so we can recap, when patients are listening, what is feeling better mean to you?
Feeling better for me is, having a bowel movement of some sort daily would be nice. And if I skip a day, I don't get anxious about it, and I have it the next day and I'm okay. That's good. I mean, I figure that's a good quality of life. And one where, yes, in the back of my mind, I'm worried about, am I going to have a bad day? And I generally know by around 10 or 11 o'clock in the morning what the day is going to be like. And then I can get on with my day. I'd like to be able to know, each day that I can just carry on like everybody else. I mean, that's what we truly want. So for me, it means being able to get on with my life, finding a regiment that works without having to change the whole cocktail up in order to manage symptoms that I'm dealing with right now, but really something that works on a regular basis.
No, that's great. So one of the classic symptoms, as you I'm sure know very well, of IBS-C is the severe abdominal pain. So a lot of the patients will say, if I don't have that pain, that's better for me that day. Do you find yourself in that camp?
Yeah, in fact, I had that typical abdominal pain this morning, and I thought, well, we're going to be speaking today, and I want to feel well, but I also want to be true to myself. And you can get through these activities. And I think one thing that I learned with IBS many years ago was that not to get so anxious that I stop doing things. So, we were speaking today, and whether I had abdominal pain or not, we were going to speak today, and I was going to be able to get through it. And, whether we're speaking for 15 or 30 minutes, I can survive for those 30 minutes. And I find for myself that it's a lot better that I do those activities and carry on with life, because things sometimes aren't as bad as I envision they might be. And I think patients really get focused on, this is going to be really bad. This is going to be very similar to what I had before. How do I get through this? And I think a lot of things that you learn related to IBS, one of them is, breathing, deep breathing, box breathing, abdominal breathing helps you get through those stressful periods as well. And just kind of roll with it and see what happens. It may not be as bad as you think it is. And in fact, my day got better. So, and here we are, and I seem to be okay right now.
You're doing great. And I thank you so much. And this was perfect. And anything we missed, did you want to give any tips for providers in asking their patients when they're feeling a certain way? Or
no, I do want to mention though that a lot of patients aren't aware that there is a new compound that's available for IBS-C, and that's Ibsrela. And it's so new that I don't have a lot of information on it. I'm hearing very, very good things from the few patients that have tried it. So I'm really interested. I have not tried it myself yet. I would really be interested for patients to have a conversation with their physician so that they know that there is another treatment. If they've exhausted everything that the doctor has, there is something new that many people aren't aware of.
Oh, this is great. Well, you did great. You
Great.
did fantastic as always. I so appreciate you.
Well, thank you again for having me.
No, you are so welcome. You are so welcome. Well, I hope you enjoyed this episode and listening to all these great patients and patient advocates. And I want to continue the conversation. So if you're watching this on YouTube, please share your insights on what you feel is better when you're talking to your healthcare provider, and what are your benchmarks for when you're explaining what you're feeling better. If you're feeling better, share them in the comments section. If you're listening to this on one of our podcasting platforms like Apple or Spotify, feel free to send us an email with, what better means to you as a patient or a provider, if you're listening as a provider, at podcast@gastrogirl.com. And as always, please remember to subscribe, like, and share this episode, and check out all of our other episodes on the Gastro Girl podcast, available on all the podcasting platforms and available in video format on YouTube. Thank you very much. See you soon.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.